Hello, I'm Judy Heidebrink. I'm a neurologist with the Michigan Alzheimer's Disease Research Center. Welcome to this presentation on clinical trials in the context of dementia. I'll start with my disclosures. I receive research funding from AZI and Cognition Therapeutics, and I've received an honorarium as a faculty member for a clinical trial course called Impact AD that I'll mention at the end of the presentation. Through this presentation, you will learn the definition and key components of a clinical trial, understand the 4 phases of clinical trials in drug development, and become familiar with participant safeguards in clinical trials. I'll start with the definition of a clinical trial. The National Institutes of Health defines a clinical trial as a research study in which one or more humans are prospectively assigned to one or more interventions to evaluate the effects of those interventions on health-related biomedical or behavioral outcomes. So often in dementia, we'll think of clinical trials as being studies of drugs to see if they might help someone's memory or thinking, but the definition of the interventions is actually much broader. It could include drugs, but also devices, procedures, or even strategies related to diagnosis, treatment, or prevention. So an educational session designed to help someone's thinking would be considered an intervention as part of a clinical trial. Just as the types of interventions in clinical trials can be broad, so can the types of clinical trial outcomes. So for example, I might propose a study of an educational session to see if it encourages exercise and the impacts of that session. My outcome could be whether the sessions change someone's behavior, whether they in fact end up exercising more after the sessions. Or I could look at a health parameter. Do the individuals improve in their strength or endurance after attending the educational sessions? Or I could look at the impact on a specific disease process. Is there a difference in chronic pain after the educational sessions? Or some type of overall measure of quality of life. Any of these could be clinical trial outcomes in a study looking at educational sessions to promote exercise. Key distinction between a clinical trial and another type of clinical research is whether individuals are prospectively assigned to the intervention of interest. So for example, here are 2 descriptions of research studies, one of which is a clinical trial, the other is not. On the left, individuals are assigned to either a high intensity or low intensity walking program for 3 months, and their test scores on cognitive tests are then compared. This would be considered a clinical trial since individuals are assigned to the exercise intervention. In contrast, if we simply ask individuals how much they have walked over the past 3 months and compare the cognitive test scores for people who report a high level versus a low level of walking, although this is still looking at the same type of relationship, it is not a clinical trial because individuals are not specifically assigned to the intervention. And this would be considered a less rigorous means of studying the question, since we might actually be tapping into whether they remember whether they walked a lot or not truly the effects of the walking itself. There are many key components to a clinical trial. Perhaps the most important is the objective of the trial. What question is the trial designed to answer? Since this will dictate many other decisions about the trial design components, such as who can participate in the trial. If the goal of the trial is to determine whether a medication prevents the development of Alzheimer's disease symptoms, it would make sense to study older individuals at risk rather than much younger individuals who would not likely have a risk of developing symptoms during the time course of the trial. What is the specific intervention? If it's a drug, how long will it be given and at what dose? And how will the effect be measured? What is the outcome of the trial? Is it a cognitive test score or some other type of health outcome? And how will the data be analyzed? What statistical analysis will be used to determine whether the intervention is having an important effect? There are also important decisions with regard to the trial intervention itself. For example, will there be a control group? A control group is a comparison group that does not receive the intervention of interest. So if it's a drug study, this might be individuals who receive either no drug or a placebo version of the drug. How will it be determined whether they receive the drug or the placebo? Will there be a randomization process where they're assigned by chance? And will individuals know whether they are receiving the active drug or not? Will they be blinded or unaware of their assignment? And all of these have important implications for interpreting the results of a clinical trial. Let's take the example of a study of a multivitamin on cognition. If there is no control group and all of the individuals take a multivitamin for 3 months and have tests of their memory before and after taking the multivitamin, if their scores improve, we wouldn't know if it was from taking the multivitamin or from simply having been asked the same questions 3 months earlier and learning from those test questions. If there's a control group, then we can start to separate out the effects of the multivitamin versus anything else that happened during the 3 months. Maybe we're going to do our study in Michigan and in Florida. What if we put everybody in Florida on the multivitamin and nobody in Michigan on the multivitamin? They served as the control group. And in the end, individuals in Florida had higher test scores. Is it truly because of the multivitamin or because something else is different? Their diets may be higher in certain vitamins, or their sun exposure may allow them to have higher vitamin D levels. So we're not really testing the intervention, but it's because the groups are different by virtue of their geography. If we randomly assign individuals in both Michigan and Florida to either the multivitamin or placebo, then we have a better way of assessing the effects of the multivitamin. And finally, blinding is important. If someone knows they are not receiving the multivitamin, perhaps they will change their diet to adopt a more healthy eating behavior. Then we no longer have a study of a multivitamin versus a placebo. It's a study of multivitamins versus healthy eating behaviors. So people's awareness of their assignment could impact the interpretation. The most rigorous studies are using control groups with random assignment and blinded to treatment assignment. I'd like to now mention the different phases of clinical trials as they pertain to drug development. The clinical trial phase is an important bridge between the preclinical research stage, where drugs are studied in the laboratory and in animal models, and the ultimate goal of getting the drugs into the clinic itself. So typically in the process of drug development, which you can learn more about in a separate presentation, there are a series of clinical trials known as phases. 3 phases occur prior to the drug's approval by the FDA, and the 4th phase refers to studies that are done after the drug is approved and available clinically. This is a brief overview of the different clinical trial phases and their goals. In phase 1, the main goal is to determine the drug safety and determine the tolerance of different doses of the drug. These studies might involve healthy volunteers and eventually the population of interest. They may not have any control group because the goal is to determine where the drug goes in the body, how long it lasts, so everyone might receive the drug. And these are relatively short trials. Individuals might get a single dose or several doses, but the trials overall last a few days, weeks, or months. In phase 2, patients are typically studied, and there is a control group. There's further information collected about side effects, but importantly, this is the phase where we start to examine whether the drug is having a desired effect. And so this would typically be a longer duration of treatment from several months to possibly 1 or 2 years. Phase 3 trials are much larger, and they typically have a control group to look at the overall risk and benefit of the drug intervention. If the drug is successful in being approved, there can also be phase 4 trials, post-marketing trials, perhaps to look at safety when these drugs are used in a broader population than the population involved in the clinical trials, or to compare their effectiveness versus an existing therapy. Let me talk a little bit more about the first 3 phases of clinical trials. Phase 1 trials, again, the emphasis is on safety, where the drug goes in the body, how it affects the body, how the body affects the drug. So pharmacokinetics and pharmacodynamics. These might be done in a research unit where individuals can stay for prolonged observation. There can be a variety of designs of trials in the phase 1, starting with a single ascending dose where one or more individuals gets a single dose of the drug to determine where it goes and how long it lasts, and whether there are any side effects. If there are no concerning side effects, then another group of individuals may get a slightly higher dose of the drug. You can also have multiple ascending doses where an individual starts at one dose, is monitored for a period of time, and then the dose is increased to see, can this individual take a higher dose of the drug? And again, what are the potential side effects and the potential effects in the body? It's also important to assess whether the drug is affected by diet, fasting, not fasting, or whether there are key interactions with other drugs. So overall, there's an evaluation of the drug's safety, tolerability, and where it goes and what it does to the body. Here's just a description of phase 1 study of the first drug that was approved as a treatment for Alzheimer's disease called Katherine. You can see from the description, this involved healthy volunteers, a relatively small number of individuals who received the study dose either after a fast or before or after a meal to determine did they have side effects depending on whether they were fasting or not, and how much drug was measured in the body depending on whether they were fasting or not. So this is an example of a series of phase 1 trials in Katherine. Phase 2 trials will typically, again, look at a patient population, a relatively homogeneous patient population with not a lot of other health conditions, with the goal of deciding, does this drug show evidence of promise? Does it look promising in treating the disease in terms of having a desired cognitive effect or perhaps a biomarker outcome effect? So it could look at the effect on an amyloid PET scan, for example. Does it change the amount of amyloid in the brain? And different doses could be compared to try to determine what might be the best dose to move forward in a pivotal phase 3 trial study while collecting additional information about side effects. And then phase 3 trials are really the large randomized controlled double-blind, often multi-center trials to both confirm the therapeutic benefits suggested by the phase 2 trials and to form the basis for the ultimate drug approval and how it should be marketed and labeled for use in the clinical setting. 3 studies are typically large in number of participants, but exactly how many participants are needed depends on different aspects of the trial design. For example, is more than one drug dose being examined, so a larger number of participants if there's more than one comparison group? What is the outcome measure? Is there a lot of variability or noise in that outcome measure so that a larger number of participants will be needed to distinguish a true effect versus random noise in that outcome measure? What is the minimum relevant treatment effect, and is our drug likely to exceed that in a substantial way? If the treatment effect is likely small and the outcome measure is noisy, a much larger number of participants will be needed. And how certain do we want to be in being able to detect a true effect of the drug versus something that might have happened by random chance? So what's our tolerance for error? Even if all of these features suggest that the ideal number of participants might be 900, we'll still want to recruit an additional number of individuals to account for dropouts that inevitably occur or other reasons where there might be missing data. So the trial should always be designed with this in mind so that even if there are dropouts or missing data, there are sufficient number of participants and data available to answer the clinical question. There are important decisions about the participants. As I mentioned previously, there are many potential options in terms of clinical trial outcomes. For phase 3 dementia trials, typically the measures are going to focus on cognition, behavior, or activities of daily living. Some of these may be combined in some type of composite measure looking at their overall clinical function. Often other measures include assessments of quality of life or the economic impact of the intervention. And here's an example of a pivotal phase 3 trial from the most recently approved intervention for Alzheimer's disease, a trial of donanemab, a monoclonal antibody in individuals in the early symptomatic stages of Alzheimer's disease. So as you can see from the description, this was a large trial involving more than 1,700 participants. It was randomized, double-blind, placebo-controlled as they were assigned to either the active drug or placebo for a period of treatment of 72 weeks. And the primary outcome was one of the composite measures, the Integrated Alzheimer's Disease Rating Scale, that combines measures of cognition and measures of function. That was their primary outcome. They also had a variety of secondary outcomes looking at different aspects of cognition, day-to-day function, as well as a variety of biomarkers. And finally, I'll mention some of the safeguards that are in place to protect participants in the context of clinical trials. Clinical trials are reviewed by institutional review boards, or IRBs. These are composed of an independent committee of both professionals and at least one non-scientist member who will review the design of the clinical trial to decide whether the trial is ethical and it protects the rights and welfares of the study participant. So they grant approval and also ongoing monitoring of the clinical trial. A key safeguard in the clinical trial process itself is the informed consent process. This is the means by which participants decide whether or not to participate in a clinical trial based on its purpose, knowing the potential risks and benefits, knowing exactly what will happen to them, how long they'll be in the trial, what types of procedures are involved, what the intervention itself is, what the alternatives are should they choose not to participate, how are the study records kept confidential, and most importantly, knowing that the trial is voluntary and they can discontinue trial participation at any point. For trials in individuals with dementia, this process might involve surrogate consent. If the individual lacks the ability to make the decision about trial participation, they may have a designated surrogate who can provide that informed consent for trial participation. And then finally, phase 3 trials and some of the earlier phase trials, depending on their scope, risks, and whether they are multi-site or not, will have a data and safety monitoring board as part of the participant safeguards. This is different than the IRB. This is an independent expert committee that will monitor the data during the course of the trial, and they have the ability to look at unblinded data to compare those receiving the drug versus the placebo to determine during the course of the trial whether there continues to be an acceptable risk-benefit ratio. So they will make recommendations throughout the course of the trial whether the trial can safely continue, whether any modifications are needed, or they can even advise on termination of the trial if there's a particularly safety concern that has arisen during the trial. So in summary, clinical trials systematically explore strategies designed to improve health outcomes, and drug therapies progress through an orderly sequence of trial phases to determine if they are safe and effective. Clinical trials have multiple safeguards to protect the welfare of participants. And this was a brief overview, but if you would like to have a more intensive training in clinical trials pertaining to Alzheimer's disease and related dementias, I encourage you to consider applying and attending the Impact AD Clinical Trials course that is held annually, lasting a week, usually in sunny Southern California. And for more information about this, please see the website on this slide. Thank you very much for your attention.